Well, good evening, everybody, and welcome to tonight's broadcast. My name is Eric Goldman, the editor of Holistic Primary Care News for Health and Healing, and I'm thrilled you've been able to join us tonight for what I know is going to be a very, very interesting presentation. We're going to be talking about, it's a great topic, we're going to be talking about digestion and how that affects immunity and inflammation. And we're going to be looking at that from the perspective of Ayurvedic medicine. And I'm pretty sure all of you, if you're here, you're aware that Ayurveda is the traditional medical system from India. It goes back for thousands and thousands of years. And as I understand it, it's the oldest medical system in continuous use globally. And it's got a lot of light to shed on many of the common chronic problems we have here in our society. So it's definitely not a museum relic. It is the bedrock of healthcare for millions of people worldwide, both in India and outside of India, including here in the United States. And we're going to be learning a bit about the perspectives that Ayurveda brings to the question of digestion, which, as everyone knows, is central to overall health. And we've got a great faculty, Dr. Charles Elder, Dr. Arti Prasad, and Dr. Śankari Wegman. They are the core faculty for Maharishi International University, which is based in Iowa. And that's the premier Ayurvedic school here in the United States. They are in connection with teachers in India, so there's a lot of cross-cultural pollination going on there, and they're making it very practical. I mean, some of it may sound arcane, but actually it has a lot of practical applications to conventional medicine in a modern Western allopathic setting. It's intrinsically holistic. The perspectives of Ayurveda are based on the idea that all the body systems actually do work together, and that something that happens over here is connected with something that happens over there. In fact, allopathic medicine is really the only system in the world that has completely divided the systems into these departments that somehow function without having anything to do with each other. And so Ayurveda very gently but very elegantly challenges those notions. And so it's going to be a great program. I'm thrilled that we get to present this with MIU, Maharishi International University. And so we'll get started in a minute. Just a couple of bits of logistics here. We do have the slides available for you as a handout. So if you look on your control panel, you'll see a little tab that says handouts. Just click on that and you'll see two files in there. One is the slide set for tonight's presentation, and the other is a little bit of information about a new fellowship program that MIU has put together, specifically designed for practicing clinicians. It's a very intensive training, and it will give you an opportunity to earn a master's degree, and it's all focused on how to apply Ayurveda in a modern clinical setting. You'll hear much more about that from our speakers tonight, but just be aware that there's a little handout in there about that. And we will be taking questions at the end of the didactic portion. So to ask a question, you'll see a little tab on your control panel that says questions. Just open that and there's a little chat box. You can type your questions in there and we will endeavor to answer as many of them as we can in the allotted time. And so again, thank you for joining us. Thank you to MIU for sponsoring this program. And with that, let me turn things over to Dr. Charles Elder.
Hi, thanks, Eric. It's great to be here.
Excellent. Okay, you are now the presenter, and I will disappear myself.
Hi, everyone. It's great to be here to talk to you about this really fascinating and dynamic topic, diet, inflammation, and immunity. And as Eric was explaining, and I think we all have a sense for, diet, inflammation, and immunity are all related, and they're all related to health. Good diet, good health. And this is often mediated through the phenomenon of inflammation and strong immunity. And we're going to talk about how. And we're going to talk about how, in terms of both modern and traditional perspectives. So we're going to talk about the Ayurvedic perspective, a traditional perspective, and we're also going to talk about a modern integrative medicine perspective, and we're going to blend those two together to give a really holistic and practical picture. And in doing so, we're going to be giving you a little bit of a taste of what our fellowship program, our new fellowship program, is going to be like. The new fellowship MS in Integrative Medicine and Ayurveda at Maharishi International University, in collaboration with the University of Arizona. We're admitting our first class for this summer. And as Eric was suggesting, we're going to be teaching how to integrate Ayurveda and general integrative medicine as a holistic whole into one's clinical practice in a very practical way. It's a 2-year distance learning training program so people can stay in their practice. It emphasizes both practical patient care and self-care. And physicians who complete the program are then eligible to sit the certification exam offered by the American Board of Integrative Medicine. So what does that look like? How do we take an issue like immunity, inflammation, chronic disease, and understand it from both general integrative medicine perspective and the Ayurvedic perspective, and apply that in a practical clinical way? That's what our curriculum is about. And tonight's session is going to give you a taste of how we do that. So the way we're going to proceed is, first, my colleague, Dr. Arti Prasad, will be joining in a moment, and she will be presenting the general integrative medicine perspective and the anti-inflammatory diet. And then we'll switch to another one of my colleagues, Dr. Śankari Wegman, and she'll present the Ayurvedic perspective on the same issue, on the same topic. Afterwards, I'll review some of the scientific data supporting the Ayurvedic paradigm, and then we'll blend it all together and take questions. So with that introduction, it's my pleasure to introduce Dr. Prasad.
Thank you. Good evening, everyone. Can everyone hear me?
That's great.
So I'm Arti Prasad. Thank you. Thank you. I'm the fellowship director of this new fellowship. I'm an adjunct professor at Maharishi International University, and I'm a professor of medicine at University of Minnesota. And I currently hold the Chief Strategic Development Officer position at Hennepin Healthcare in Minnesota. So today's objectives are about the anti-inflammatory diet and the modern perspective, to discuss the cause and role of inflammation in diet and health. I would like to talk about some ways to measure inflammation in the body, and we will explore together anti-inflammatory dietary components and what those mean. So this is a very big topic, and we will only be able to present the tip of the iceberg tonight. So what is inflammation, and why does it matter? So inflammation is a natural phenomenon in the body. It is body's immune system's response to any kind of external stimulus, which can be in the form of a bacteria, trauma, toxin, virus, or any kind of unregulated immunoreactivity. As we know, it has many components. Inflammation can happen at the cellular level, at the molecular level, such as cytokines, ferritin, CRP, some of the measures of inflammation that we know about. Vascular and microbiological basis. We have been hearing about gut microbiome a lot of research is coming in microbiomes. And then, of course, neural mechanisms also cause inflammation. And acute inflammation resolves after the damaging insult is gone, but chronic inflammation persists even after the insult is gone. So chronic inflammation causes immune activation, presence of lymphocytes and macrophages, and other cellular markers. And then ultimately it results in angiogenesis, fibrosis, and tissue destruction. And it can lead to chronic diseases based on this chronic inflammatory responses. So some of the diseases which happen because of chronic inflammation are cardiovascular disease, diabetes, obesity, Alzheimer's disease, autoimmune inflammatory arthritis, gastropathies, and also cancer and neoplasms. So what are some of the clinical markers of inflammation, and what do they mean? So first one is that we have learned all the way from medical school is ESR, erythrocyte sedimentation rate, which is a non-protein acute phase reactant that is measured. It reflects actually the plasma viscosity and the presence of acute phase proteins called APPs. An ESR of more than 100 is usually an indication of a severe infection, such as tuberculosis. ESR is very high, endocarditis. It can also increase in tissue injury and necrosis, like in acute MI, surgery and burns, and acute or chronic inflammatory disorders such as polymyalgia rheumatica, temporal arteritis, inflammatory bowel disease, and gout. On the other hand, CRP, C-reactive protein, or highly sensitive C-reactive protein, which is a sensitive measure in the lab of C-reactive protein, is elevated in any condition that is associated also with tissue destruction, infection, inflammation, or cancer. And when it is highly elevated, it is most commonly associated with an infectious cause. So both SED rate and CRP, when they are extremely high, there's an infectious cause. There are other conditions in which a highly sensitive CRP is elevated, such as obesity, insulin resistant, pancreatitis, even oral contraceptive use, chronic fatigue, even mild alcohol consumption, depression, and then, of course, increasing age, trauma, and also some cancers. But C-reactive protein and cardiovascular diseases have a closer relationship. And it definitely requires a special mention because CRP in cardiovascular diseases is considered by some as a simple marker, and some people think it's the true risk factor, and even the effectiveness measure of any new therapeutic approach targeting inflammation, so you can follow CRPs. And it is believed to have a high negative predictive value, so when it's not present, that's a good sign. An association of CRP with cardiovascular diseases, that risk varies by gender and diet quality. So this is some information here about a 2020 study which used the data from the NHANES survey, National Health and Nutrition Examination Survey, linking the mortality cohort between 1999 to 2011, which included almost 9,000 men and 10,000 women. And there was a median follow-up of 6 years. And in men, there was a significant association between CRP and overall mortality risk, such that men with the highest CRP had a 6-fold increase in mortality. And this was compared to men with the lowest CRP who had a 1-fold increase risk, and P was significant, less than 0.001. And in men, CRP and mortality from cardiovascular disease varied by diet quality. In women, CRP was not associated with mortality risk. So what does it tell us? This finding really underscores the anti-inflammatory potential of diet, and also serves as a reminder to us that CRP interpretation must take diet into account. It can be followed periodically with dietary changes. This is a picture of it's an overview of omega-3 and omega-6 UFA metabolism, unsaturated fatty acid metabolism, showing the potential association between the measured unsaturated fatty acids and the inflammatory markers. So all the things which are seeing in this picture in red are associated with increased risk of disease pathology, so like leukotrienes, prostaglandins, thromboxanes, are in red, so they are showing the increased risk with diseases or increased risk of diseases with those inflammatory markers. And the levels, which are very nice names, protectants, resolvins, these are the protective markers. And I'll talk a little bit more about that in the next slide, and I can come back to this slide also to elaborate. So let's talk a little bit about the arachidonic acid and the EPA. This arachidonic acid is an omega-3 fatty acid, which is a precursor to inflammatory prostaglandins and leukotrienes. And EPA is an omega-3 fatty acid that competes with the cyclooxygenase and lipooxygenase enzymes, which generate inflammatory cytokines from arachidonic acid. So instead it produces resolvins, which I showed in the previous picture, and I'll go back here to show on the right-hand side of this diagram right here, how EPA is interfering to create more resolvins, so resolving inflammation. The serum ratio of EPA and arachidonic acid is an indicator of chronic inflammation, and specifically of the balance between the beginning of the inflammation and resolution of inflammation. So lower EPA and arachidonic acid ratios are associated with an increased risk of cardiovascular diseases. And similarly, it was observed that the lowest quartile of EPA to AA ratio in Japanese adults, P significant, p-value 0.29, was associated with a 93% increased risk of cancer mortality compared to the highest ratio, more than 6.0. So an elevated AA, arachidonic acid to EPA ratio, is correlated with various chronic inflammatory conditions. Highest AA to EPA ratio was associated with a 4.1 times increase in a population, and depression was seen in this Japanese population. So significant AA to EPA ratio was, they were found also in tumor tissues of patients who had colorectal cancer, suggesting the ratio can be used to monitor the progression of colorectal cancer. And in the same study by Tutino, they also found a significant association between AA to EPA ratio and the staging of the tumor, but not in the histologic grade. I'll talk just briefly about the advanced glycation end products called AGEs. These are just heterogeneous group of compounds which are normally formed in the body. But in 2019, it was determined by Camille Maillard, the scientist, that excessive high levels of AGEs, when they accumulate in tissues and in circulation, they become pathogenic, and they are implicated in the onset of atherosclerosis, cardiovascular diseases, diabetes, its complications, and many other diseases. And as most modern diets are largely heat processed, they are more prone to contain high levels of advanced AGEs. What are some of the sources of AGEs? As I mentioned, that they are formed de novo in the body. They can be present in conditions of increased oxidative stress, as a waste product of metabolism, exogenous diet, such as they can come from inflammatory diet and tobacco smoke, and they can also be increased when there is impaired renal clearance. And how can these AGEs be decreased in diet? So carbohydrate-rich foods such as vegetables, fruits, whole grains, and milk contain relatively few AGEs, even after cooking. Formation of these AGEs can be reduced by cooking with moist heat and using shorter cooking times, cooking at lower temperatures, and by use of acidic ingredients such as lemon juice or vinegar. So if somebody enjoys grilling, they can use lemon juice or vinegar to reduce the production of these AGEs. So coming to the anti-inflammatory diet, what is it? Well, it's the idea is simple, that anti-inflammatory diet is the eating pattern of an individual or us as a population, which reduces the incidence of chronic diseases. It has the potential to improve healthy aging and reduce the risk of chronic diseases. So as you may have heard, the SAD diet, which is Standard American Diet, that most of our population consumes, it is high in saturated fatty acids, trans fatty acids, sodium, refined carbohydrates, and ultra-processed food. So anti-inflammatory diet is an aid, which is high in monounsaturated and omega-3 polyunsaturated fatty acids, which come from marine sources, and nuts and vegetables and seed fiber, legumes, whole grains, lean protein, spices, and minimally ultra-processed foods. So all the anti-inflammatory diet, it varies per individual, and it can collectively reduce chronic and systemic inflammation. And obviously there is, depending on the culture or cultural diets, there is variability in the anti-inflammatory or pro-inflammatory effect of diet. And there are several health conditions and habits, such as body weight and our activity level, our smoking status, all of that modifies the inflammatory impact of diet. So how do we assess the inflammatory effects of diet? Don't go by the large amount of content on this slide, but one could use, and these scales have been used in studies to measure the anti-inflammatory effect of different kinds of diet. Simple one is Healthy Eating Index, HEI. It assesses overall dietary quality. And the impact of diet on inflammation can be quantified by the serum markers that I talked earlier about, like CRP or interleukin. So you can put somebody on anti-inflammatory diet, and then you can follow the levels of these inflammatory markers. The second index is called the Diet Inflammatory Index, DII. It's actually a calculation which is derived from the daily intake of 45 dietary factors, which had been found in almost 2,000 studies to modulate systemic inflammatory biomarkers. So we have been hearing a lot about Mediterranean diet, great studies on Mediterranean diet. It has a diet inflammatory index, DDI of -4.0. compared to a DDI of +4.0 for a fast food diet. So that speaks a lot in favor of Mediterranean diet. And then the last one is Empirical Dietary Inflammatory Index, EDII, and it is based on food groups and was developed in US populations using data from the Nurses Health Study, as well as the Health Professionals Follow-up Study. And it has been validated in a Japanese population against other dietary indices. This is the anti-inflammatory diet pyramid introduced by Dr. Andrew Weil, widely available on his website. You can Google it, you can find it. I keep it in my office, I keep it in my clinic. This is the most common, most used handout in my practice with patients. So as you see in this dietary pyramid, that at the bottom of the pyramid, what we have are colorful fruits and vegetables, followed by complex grains, seeds and nuts, and then meat which have high omega-3 fatty acids, such as cold fish and salmon. And if you're a vegetarian, you can omit that, and you can get your omega-3s from seeds and nuts. And chia seeds, as well as walnuts, have high amounts of omega-3s. Then it goes into protein, whole soy foods, and then anti-inflammatory mushrooms, hard cheeses and eggs, and then use of anti-inflammatory spices. That's where the principles of Ayurveda come in. As you see turmeric there, you see paprika there. All of these anti-inflammatory spices can be used or should be used in cooking on a daily basis. and then green tea and the use of supplements, and a small amount of wine. But if somebody who's not a wine drinker or alcohol drinker, I never recommend that they start doing that. And then for dessert and to meet the needs of a sweet tooth, there is dark chocolate. So this is the anti-inflammatory diet pyramid. And then this is the other handout, which is the second popular handout in my practice that I share with patients. And it's really fun to do that. It's called the Dirty Dozen and Clean 15. And every year USDA comes with a new list of the Clean 15 and the Dirty Dozens. And it changes a little bit, but some of these fruits and vegetables still stay in those lists. So recommending patients, because a lot of patients feel that they have to eat organic all the time, and this is a good handout to tell them that there are lots of things that they don't have to get organic. They can actually eat. So these are the things which you may want to get organic recommendation because they are on the Dirty Dozen list. So just to summarize my presentation from today is about the evidence that chronic inflammation is fueled by a variety of lifestyle elements, including diet. And there are research methods that use standardized indices to assess the inflammatory nature of a diet. The three indices that I talked about, I don't use them in my practice. They have been used in research, but I do follow the inflammatory markers at times. And then understanding the inflammatory impact of diet is derived from the overall composition of diet and not relying on just single nutrient. So it's really important to counsel patients on the pattern of eating and the diversity of food instead of focusing on single foods. Thank you. I am done with my presentation, and I am going to now introduce my colleague, Dr. Śankari Wegman. But for that, oh, here she comes. I'm going to unshare my presentation. Sorry. Okay, stop showing screen. All right.
Okay, thank you, Dr. Prasad. And if you could make the presenter, I will go ahead and start sharing. Yes, thank you. So let me go ahead and share my screen.
Yep, we are seeing your screen now.
Okay, great. Thank you so much. Wonderful. So thank you so much, Dr. Prasad, and thank you so much, Dr. Elder, and to Eric. Hello, everyone. My name is Dr. Śankari Wegman, and I'm the Assistant Director for the Fellowship Program. I've been a practitioner of Maharishi Ayurveda for over 20 years, and I'm on faculty at Maharishi International University and also for the clinical residential weeks for our master's program. And I'm so grateful to have been mentored by Dr. Manohar, who's a wonderful, world-renowned Vaidya or Ayurvedic physician in this art of Ayurveda. And it's a real joy for me to be a part of this program. This is the first integrative medical fellowship to have a specialty in Ayurveda for health practitioners. And I'll be sharing some of the Ayurvedic perspective on our topic today of diet, inflammation, and immunity, and how the concept of diet, how it affects our understanding of imbalance and inflammation and ways to maintain immunity. So just to start off with, Ayurveda really looks at digestion as a pillar of health. Good digestion is for good health. And this word Ayurveda, many of you might be familiar with, but for those who might not be, just to start with this understanding of what Ayurveda is, it's made up of two words, Ayu meaning life, and Veda meaning knowledge. So Ayurveda can be understood as the science of life, And it's a prevention-based ancient system of healthcare that is holistic. It focuses on the whole person and all the various functions of the physiology, from gross level functioning to subtle levels of functioning, can be categorized into 3 categories known as the 3 doshas, or Vata dosha, Pitta dosha, and Kapha dosha. Vata dosha governs all aspects of movement and communication. Pitta dosha governs metabolism and transformation. Kapha dosha maintains the structural integrity of the physiology. So balance of all 3 doshas is an expression of balance of health, and all 3 doshas have a role in balanced digestion. And digestion is really the key to understanding this, in understanding the perspective of how inflammation arises. So health is understood from Ayurveda as being established in the self, and proper digestion, or strong digestion, is equated with strong immunity. So immunity, vitality, enthusiasm, health, energy, all of that has a direct connection with strong digestion from the Ayurvedic perspective. And Ayurveda locates weak digestion as the root cause of any imbalances, such as chronic inflammation. So Ayurveda offers a variety of natural approaches to addressing chronic inflammation, and one of the primary approaches is through diet and nutrition. And Ayurveda emphasizes a whole plan of diet that focuses on plant-based diet, whole foods, with an emphasis on fresh fruits, fresh vegetables, whole grains, healthy fats. And just to start out with this quote from one of the texts of Ayurveda, Charaka Samhita, Chikita, it describes the importance of the role of digestion for health. So in this quote, it reads, "Thus the fire of digestion and metabolism is the root cause of everything. The nourishment and maintenance of the tissues of the body, immunity, strength, complexion, etc. by food depends on digestion and metabolism." So really, this is one of the key phrases. The fire of digestion and metabolism is the root cause of everything. So by its strength, it expresses immunity. By any weakness, it creates that seed, that bed for imbalances to grow. In Ayurveda, this understanding of digestion, strong digestion, is equated with having a strong Agni. Agni is that Ayurvedic word for digestive fire. And just as the sun represents Agni in the universe, so the sun, which gives energy and is a source of growth, a source of energy and dynamism in nature, in the same way, in the individual physiology, the digestive fire, or Agni, known as Jatar Agni, this is what gives that value of strength, energy, transformation, the strength of digestion and metabolism in the individual physiology. And the finest and final product of digestion and metabolism is known as ojas. Ojas, we can say, is a byproduct of proper digestion, and it has an important role in maintaining optimal health and immunity. Ojas is just that finest, most refined product of digestion and metabolism. And Ayurveda understands ojas as the integrated intelligence of the physiology. It's the perfect balance of the doshas. And there's a direct correlation between ojas and strong digestion. Ojas is responsible for strength, for immunity, for bliss, for longevity. And we can enliven ojas through balanced diet and balanced digestion. There's a beautiful quote from Bhava Prakash Samhita, another text of Ayurveda, that describes ojas as ojas is evenly distributed throughout the body. It is unctuous, cold, pleases the body like moonlight, and it provides the body with strength, stamina, and good physique. So how can we optimize Agni to always promote ojas? So Ayurveda offers numerous guidelines to optimize Agni in this way, to maintain a strength of immunity and resistance to imbalances. And it gives guidelines not only for what we should be eating, what we should be avoiding eating or drinking, what we should be favoring in terms of our diet, but it also looks at how to eat, the process of how we prepare the foods. So that whole, the how, the when, all of that Ayurveda looks at, not just at the what of diet. So a few of these principles, few of these guidelines that Ayurveda has so that digestion can always be strong. I'll just go over some of them. So the first one is to eat in a quiet and settled atmosphere with a settled mind. And that means to eat without distractions. So eat without rushing, eating without multitasking, sitting to eat, avoiding eating too fast, which happens a lot in these days, and really giving our full attention to our meal. This is really an important factor to create good digestion, as it allows the digestive system to work most efficiently and helps in reducing stress, which can interfere with the digestive process. So in this way, Ayurveda really looks at the state of mind and body as we're eating. Another principle or guideline that Ayurveda recommends is that the main meal should be had at lunch. And just as the sun is at its zenith at noon, so is the digestive fire, or Agni, the highest at midday, at noon, right at lunchtime. There's more availability to digest any heaviness in the meal, so the main meal is taken at lunchtime. And this is most conducive to proper digestion and absorption of all nutrients in the meal. Breakfast and dinner are lighter in quality, lighter in quantity, with lunch being the main meal to optimize that full digestion and absorption of nutrients. Another Ayurvedic guideline is that Ayurveda recommends to avoid any ice-cold beverages or foods, as this can be heavy for digestion. That cold value is opposing to the qualities of the digestive fire. So Ayurveda recommends more room temperature or warm water, warm foods, which aid that efficiency and effectiveness of the digestive process. So we've talked a little bit about, the state of mind, maybe when to optimize eating our meals, and just even the qualities of the foods in terms of temperature. Ayurveda also looks at how the food is prepared. So this is also very important because this also affects those subtle qualities of digestion. One, that food is prepared in a pleasant environment by someone who's happy, someone who's settled. And so that saying that food cooked with love just tastes better comes to mind. So the specifics of how food is prepared, how the different foods are combined, along with the state of mind and heart of the one who's cooking the food, is very important. Food should always be delicious, should always be pleasing to the senses. So just even looking at the food, that process of digestion starts. So taking time to appreciate the food, give thanks for the food, is also important. And as mentioned before, favoring warm foods, well-cooked meals, avoiding raw foods, cold foods, as this can be very heavy for digestion. And also, it's very important that the food should be fresh and of best quality. So avoiding any processed foods, avoiding leftovers, as this is also considered heavy for digestion. And favoring, like Dr. Prasad mentioned, the clean 15, avoiding the dirty dozen, all of that is also helping to optimize our digestion. So all of these factors, when to eat, how to eat, what to eat, are all factors that Ayurveda incorporates into really allowing the full receiving of the nourishment from everything that we're eating. Ayurveda also incorporates the knowledge of the tastes in helping to balance the doshas and to optimize Agni. There are 6 tastes from Ayurveda, as you can see here, and sweet, sour, salty, pungent, bitter, and astringent. And each of these tastes have a role in how they strengthen the physiology. For example, the sweet taste nourishes the body, promotes overall strength and vitality. The pungent taste stimulates metabolism and circulation. The bitter taste supports any kind of detoxification and can also have anti-inflammatory properties. Astringent taste in the same way, it helps to tone and tighten the tissues. So each of these 6 tastes can either aggravate or pacify the 3 doshas. And this knowledge really of the taste really helps to create a personalized diet for the individual's unique constitution. So this is a really great way in, incorporating a very rich, diverse meal, and in this way also preventing that bedrock of chronic inflammation from starting. So you can see that the attention to the digestive fire is so important. And when the digestive fire becomes weak, then this leads to what is known as ama, or impurities. So weak digestion leads to ama accumulation, which is how chronic inflammation begins. So ama, or impurities, is something that can start to clog the channels of the body, preventing nutrients from being delivered efficiently to the cells and preventing waste from being discharged efficiently from the body. And the Ayurvedic concept of ama can be thought to be a toxic, pro-inflammatory waste product of improper digestion. So when the digestive fire is out of balance, then the doshas are out of balance. And some signs and symptoms of this imbalance or of ama in the physiology are indigestion, constipation, any kind of blockage or obstruction, and fatigue that is both at the mental level as well as the physical level. And this is from Ashtanga Hridayam Sutrasthanam. So how can we remove this ama? How can we remove this kind of pro-inflammatory product? So Ayurveda has different procedures for helping to reduce and eliminate ama. Some steps that are involved are as follows. So the first is avoiding the causative factors. And as Dr. Prasad mentioned, it's really the ongoing causative factors that leads to a chronic response and inflammation for that to persist. So observance of guidelines that we mentioned relating to proper diet, proper intake of food are really important, such as avoiding overeating, avoiding eating until the previous meal has been digested, having lunch as the main meal, having a light dinner, earlier dinner, also avoiding cold beverages and food, eating with the full attention. So really, favoring these factors which promote strong digestion. The second is to start the use of digestive substances to help break down the ama. This involves certain spices, such as Dr. Prasad mentioned turmeric, black pepper, cumin, etc., as well as certain herbal preparations. And then the third is a cleansing of the digestive tract. And there's specific herbal preparations for this procedure. The fourth is enhancement of the digestive power, or strengthening that Agni through specific diet and specific vegetables, grains, spices, etc. And there's a whole procedure of days of going from a very light liquid diet, progressing to thicker soups, semi-solid foods, to solid foods. And this is done over a period of time with a specific set of diet. And the last is elimination therapy. And these are effective procedures to eliminate deep-seated ama, which otherwise could not be removed just by diet alone. So this is a preventive measure that this program is applied even seasonally to remove accumulated physiological toxins, or ama, so they do not carry over into the next season. This program is administered under the supervision of a trained medical doctor and an Ayurvedic physician, with appropriate consideration to the individual's digestive state. So in this way, Ayurveda really looks to eliminate this value from ama from getting deep-seated in the physiology. So these different Ayurvedic guidelines and recommendations, along with these elimination therapies, are different ways that Ayurveda helps to maintain the strength of digestive of the digestive power for the individual, and all to maintain ojas, all to maintain full immunity, so that any imbalance that is trending towards chronic inflammation are naturally and effortlessly avoided, prevented, and eliminated with these daily and seasonal regimens to improve overall strength and vitality. So in this way, Ayurveda is really looking at how to optimize digestion for strong immunity. So I'll now pass on to Dr. Elder, who will be talking about some of the scientific research behind these Ayurvedic recommendations. So Dr. Elder, I will just stop sharing and there we go. Thank you so much.
Can everyone see my screen?
Yes.
Wonderful. Thank you, Dr. Wegman and Dr. Prasad, for those outstanding presentations. I'm Dr. Charles Elder. I'm the Executive Director of the Fellowship in Integrative Medicine and Ayurveda at NYU. And I have over 3 decades of experience in clinical practice as a primary care physician and as an integrative medicine physician. Now, let me review in a very simple way some of the concepts that Dr. Wegman just presented. So it's really very simple from the standpoint of Ayurveda. We have the concept of Agni, which is the digestive fire. And we might correlate that with the digestive juices and the digestive enzymes in the stomach and the small intestine. And when digestion is good or strong, the natural product of strong digestion is ojas. And if digestion is weak or improper, the byproduct of improper digestion is ama. Ojas we'll think of as the byproduct of proper digestion, good. Ama, the byproduct of improper digestion, not so good. Ojas in Ayurveda is equated with immunity. Strong ojas and strong immunity are really one and the same thing. In contrast, ama is the byproduct of improper digestion and can be associated with is really the ground, accumulation of ama is really the ground floor where disease gets in. And we can think of ama in terms of dysbiosis. We can think of ama in terms of intestinal hyperpermeability. In Ayurveda, we talk about absorption of incompletely digested food particles with ama accumulation. In a more modern sense, we talk about intestinal hyperpermeability. Sounds familiar, right? With ingestion of improperly digested food molecules, triggering chronic inflammation, autoimmunity, and chronic disease. So there's a big focus in Ayurveda on digestion, maintaining strong Agni to promote ojas, and to prevent or eliminate ama accumulation. And Dr. Wegman reviewed some of the Ayurvedic guidelines for managing proper digestion, promoting proper digestion, eliminating ama. And a lot of these are, 1, very simple, and 2, supported by scientific data. So one of the main things that we'll tell people in our practice is to eat during the day and not at night. This is a ridiculously simple thing to talk about. It's not always so simple for people to understand, comprehend, or even implement in their lives, but it is central. The importance of this can't be overemphasized. So many times patients will come in with any number of chronic symptomatology patterns. I'm fatigued, the things that you see in your practice all the time. I'm fatigued, I have chronic pain, I'm depressed, I have no energy, I'm bloated, my digestion doesn't feel right, etc. All that constellation of chronic complaints. So we hear so much in primary care. And then you ask the patient, well, when do you eat? Tell me about your diet. Well, and it turns out the patient's having a heavy meal at night. And you take that, you advise the patient, and the patient follows your advice. Switch that heavy meal to midday, and you would really be surprised how much that one simple intervention can impact the patient's clinical status. And again, this is supported by what we know about the physiology. So for example, we know that gut motility is better during the day than during the evening. Insulin levels come up during the day and begin to go down in the evening. Insulin resistance is higher during the evening. So if you take a meal and you give it to a patient, same meal, midday or evening, the same meal in the evening will produce a higher glucose spike. Same patient, same meal, higher blood sugar in the evening than during the day. Saliva production is higher during the day, and so on. You can see some references here and in your handout, which very nicely review the circadian digestive clock and the science behind that. Now, if you take experimental subjects and you put them in a room and you expose them, and you expose them to bright light compared to dim light, those exposed to bright light will show evidence of improved carbohydrate absorption and improved stomach myoelectrical activity. There is epidemiologic data showing that people who eat late at night are more likely to be at increased risk for heart disease, obesity, and metabolic syndrome. Very simple guideline. Don't eat so much at night. Main meal at midday, very powerful clinically. Here's a second example. Things that Dr. Wegman already introduced, but let's talk about it. Very practical for clinical practice. May surprise your patients at first, but something that's very powerful and useful and clinically impactful. And it's simply stated, warm and cooked are good, cold and raw, not so good. Now, fresh fruit has been cooked by the sun. You don't have to cook your grapes, but most everything else you want to tell your patients should be warm and cooked versus, or at least room temperature, versus cold and raw. So this means that the most overrated dish in the country is what? Salad. Well, a little bit of salad at lunch is okay, but big salads at night, not so good, not such a great idea. Why? Because it's hard to digest, accumulation, chronic inflammation, and so forth. Lots and lots of vegetables in the diet, according to Ayurveda, cooked. Vegetables are way underrated, especially cooked vegetables. Now, one of the things that we'll tell our patients to do is to sip hot water throughout the day. Just get a thermos, fill it with plain hot water, and sip it throughout the day. Anything warm heats up the digestive fire, that is good. Anything cold subdues the digestive fire and is not so good. So just frequent sips of plain hot water clears the schrotas, eliminates AMA, a good low budget detoxification for just about anyone. And the corollary of that is, of course, cold beverages are off the menu. Ice cream is off the menu. Iced beverages off the menu. Now, if it's 105 degrees outside and you want to put a little bit of ice into your water to get it down to room temperature, okay, in that circumstance. We're not trying to be weird, but as a general principle, nothing cold. And we can understand that things that are cold will stimulate a fight or flight sympathetic nervous system response in the gut, while things that are warm will stimulate a rest and digest parasympathetic effect on the gut. In clinical trial data, in post-abdominal surgery patients, warm water intake has been shown to result in improved first flatus expulsion and gut motility. In patients with esophageal achalasia, hot water was found to reduce, lower esophageal sphincter resting pressure, to assist lower esophageal relaxation, and to shorten the contraction duration of the esophageal body and to relieve symptoms. Cold water consumption was noted to have the opposite effects. And as an added side benefit, investigators examined the impact of a hot drink on 30 subjects with viral respiratory symptoms. Compared to a room temperature drink, the hot drink provided improved symptom relief. And from the standpoint of Ayurveda, anything cold will stimulate kapha dosha. Dr. Wegman was talking about the 3 doshas, which in turn stimulates mucus production. So again, especially if someone has a cold or respiratory symptoms, or all the kids who come into your practice with stuffy noses and ear infections and sinus infections, a lot of that is caused by cold beverages in the kids, ice cream, cold juice. No cold beverages, room temperature only, even better warm, and a lot of that goes away. So immunity is what? Immunity is the ability to resist imbalance and disease, right? This ability has at its basis the self-referral functioning of physiology, which is the state of physiology corresponding to the self-referral state of consciousness. So this is a bit of a new idea, but we see at the bottom Ojas and Agni, and they reinforce one another. Ojas, the byproduct of proper digestion, stimulates Agni. Agni is the digestifier. Agni, when it's strong, creates more Ojas, and it's a positive feedback loop. And at the basis of all of this is the proper holistic functioning of the physiology. So the Ayurvedic approach, as we teach it at MIU, is a consciousness-based approach. There's a big emphasis on meditation, on mind-body, on maintaining the proper connection of the physiology to its source in pure consciousness, the field of pure consciousness within each of us. And when our physiology is functioning in sync, in harmony with, as a natural extension of that field of pure consciousness, that's Ojas, which stimulates Agni, which stimulates Ojas, which stimulates Agni, which stimulates pure consciousness. So all these things are related in a very holistic and integrated way. Now, you've gotten a little bit of a taste for how Ayurveda and general integrative medicine both conceptualize the importance of diet and the gut in health. And this gives you a sense for how we are going to approach the training of our fellows and the education of our fellows in our fellowship. And as I mentioned, we are now accepting applications for the first class in our fellowship, which will begin this summer at the end of August. It is a 2-year distance learning program leading to an MS degree. It's about 1,200 hours. If you can stay in your practice, it's about 10, 12 hours of work per week. And you could do it on your own time. About half the material is Ayurveda and half the material is general integrative medicine. There are live webinars every other week and 1 week on site per year in our clinic at Maharishi International University in Iowa. Beyond that, you learn at your own schedule. And one of the things that, again, I will emphasize about the paradigm we're discussing and about the fellowship is that it's all very practical. These are things that you can implement immediately in your practice, not only diet, but also herbals, mind-body therapies, 5-sense therapies. You'll learn the art and science of Ayurvedic pulse diagnosis and so forth. One of the things in Ayurveda and in our program to emphasize is that self-care, good self-care and good patient care are really one and the same. So there's a strong emphasis on self-care and on learning how to improve how you take care of yourself so that you can thrive and succeed in your practice. And our program is provisionally approved by the American Board of Integrative Medicine. MDs and DOs who complete the program can sit for the certification exam offered by the American Board of Integrative Medicine. And everyone who completes the program, MDs, DOs, nurse practitioners, PAs, naturopathic docs, dentists, doctors of pharmacy, anyone who completes the program will get an MS degree. So that concludes our discussion, and I am going to invite my colleagues back for Q&A.
All right. Thank you very much, Charles and Śankari and Arti. So yeah, we'll take some questions now. Again, if you have questions, just open up the little questions tab on your control panel, and you can type the questions in there and we'll read them out, and the faculty will answer them in turn. And if you haven't already downloaded the handout, just go to the little tab that says handouts. Just click on that. It opens a little box and you'll see 2 PDF files in there. So you click on those and those open up your computer. And so I'll kick things off. I just curious observation. I couldn't help but notice that the Ayurvedic term for accumulated toxic substances is spelled AMA. So I don't know, maybe somebody needs to call that little medical organization in Schaumburg, Illinois, and let them know that.
There's been a lot of jokes about that, yes.
Yeah, okay. I'm wondering, what does Ayurveda have to say about salt? You know, because we hear a lot in Western medicine that, you know, salt is bad and it's one of the drivers of cardiovascular disease. I mean, are there any particular Ayurvedic perspectives on that?
Salt is a very important taste in Ayurveda. All 6 tastes are, and salt, each of the tastes are helping some aspect of digestion. Salt really helps the appetite. It helps, you know, it helps promote that Agni, or that digestive fire. It's helpful for pacifying Vata, but we have to be careful, you know, for Kapha. It can aggravate Kapha. So there's certain doshas also you want to be kind of careful for different dosha types, but all 6 tastes are recommended, but some of them can be more or less depending on the individual. It also helps, you know, electrolyte, you know, balance, all of that in the physiology. So it's very important for digestion, but the amount of it can be individualized.
Can I comment as well? So that's exactly right. And there's a tendency, because people eat so much processed foods, they have way too much salt in the diet, I think, in the typical Western diet. But as Dr. Wegman said, within reason, whether salt is good, the amount of salt, more versus less, depends on the dosha, the body type. Salt, the salty taste will balance Vata, but it aggravates Pitta and Kapha. So it's individualized.
So let's go into that a little bit more, because that concept of constitution, as I understand it, it's a very well-defined concept in Ayurveda. Here in the West, in Western medicine, we have sort of a general sense that, like, people have different constitutions, but at least to my understanding, it's not really clarified what that means in Western terminology. So could you all get into that a little bit, because I think it's an important concept.
Eric,
Sure.
can I just provide a comment related to that, and then I'll have Charles and Śankari provide the Ayurvedic perspective on the constitution. You know, I think we have learned in Western medical practice that, you know, we just cannot take one approach for everyone, but that's the tradition. Like, you know, you have hypertension, you prescribe X drug, that's the first line therapy for hypertension. And I have often seen in my practice that drug does not work for everyone. And the same thing happens, you know, patients tell us that, you know, this is not working for me, then we try something else. And then maybe the 3rd or 4th thing works for them. But in our other patients, it was the first thing that worked for them. So I think we need to really reflect on that and see why this is happening. And, you know, if the studies, all the double-blinded placebo-controlled trials are telling us that this drug was studied in this particular population, and this is the therapy you use, there's still something happening in our body which is making us so unique and that we are not responsive to a particular therapy. One is different. I think we learn it that way by in a standardized approach, and then we learned that, oh no, it's a variable approach. It's not just a standardized. You start with the standard approach, then you change. And also the very large clinical trials based on which we are providing therapies for common conditions. I think we need to start looking at the diversity of those patients and how those patients were actually recruited for the study, and who are we actually generalizing. What is a population that we are generalizing it to? I think it's very telling that we are really not honoring the uniqueness of culture, of people's diet, their bodies and their minds.
Beautifully stated, Dr. Prasad. And Dr. Prasad's completely correct. So you see these big drug trials, for example, and we see, well, it worked or it didn't, but we never learn who did it work for and who did it not work for. So that's a very important concept. In Ayurveda, we have these 3 doses: Vata, Pitta, Kapha, and they can broadly correspond with constitutional types. So when your patient walks in the door with a little bit of exposure and training, you immediately start sizing that patient up. And was this a Vata person, a Pitta person, a Kapha person, or a combination perhaps of 2 of those? And in a word, Vata is light, dry, the quick, like a snake or like a hummingbird. Pitta is intense, like a tiger. And Kapha is heavy, slow, sweet, like a swan, like an elephant. So we can talk about this for quite some time, but immediately you start to get a sense for which of these profiles most closely match your patient and to what extent, and which of these doshas might be imbalanced. And this really gives you a refreshingly useful tool to complement your allopathic skills in approaching patients with chronic disorders.
Great, thank you. I'm wondering, I've got a lot of questions about the dietary recommendations. For example, is it a general rule in Ayurveda that people ought to be vegetarians, or should some people eat meat? What about things like butter? I mean, I know, for example, in a lot of Indian cooking, ghee, which is a clarified butter, and paneer, which is a type of cheese. There's a fair amount of dairy in those cooking traditions, but here we hear so much about lactose intolerance and allergies to things like dairy. So how do you reconcile those in a practical way when you're working with patients?
Dr. Wegman, you want to start with that?
Yeah, no, it's a great question, and there's no like a have to anything. It's just more that we always look at the state of digestion, and that could vary from individual to individual, from season to season, in different ages, whatever the body is requiring. There's certain foods that are a little bit heavy. Non-vegetarian foods are a little bit heavier to digest. We've talked about some heavy foods, in this presentation. So for a person who has weak digestion, that could be hard for them to absorb the full nutrients from the meals that they're having. So the main goal is really to optimize digestion so that anything that is being eaten, anything that is being received by the body can be transformed into ojas. So we always want to look at the state of digestion. And so perhaps if digestion is a little bit weaker, certain things are recommended that are more easily absorbed by the physiology. And as digestion builds and as digestion is stronger, certain things that are heavy can be, taken in by that person. And so we always want to look at the individual, the state of their digestive fire, their age, their state of mind, emotions, the season, all of that. So it's really personalized, and not just personalized forever, personalized in that moment. And as we go through time, those changes to the dietary recommendations could also be altered as the digestive fire kind of changes with time also.
As a very simple general rule, Eric, you are correct that according to Ayurveda, the ideal diet is a lacto-vegetarian diet. So vegetarian diet that includes dairy products. You don't have to be vegetarian to be playing the game right. If you're going to have meat, poultry, fish, or eggs, more at lunch, less at dinner, because those are heavier foods and harder to digest. But it's important to remember with the dairy products in Ayurveda that it's not just anything goes. There are specific rules that have to be followed. So for example, milk, great, fantastic. One of the best substances for cow's milk, one of the best substances for promoting ojas, or a complete disaster, depending on whether you know the rules or not. And what are the rules? Well, what's the first thing I'm going to say? Cook it, boil it, drink it warm. Mm-hmm. And either by itself or with something sweet, but don't combine it with sour, salty, and bitter foods, okay? So, and yogurt's a heavy food, but lassi, diluted yogurt, ideal food, especially after lunch. So there are specific, and we could talk about the dairy products for quite some time, but there are specific ways that it needs to be done. It isn't yes or no, and it depends on the individual.
Eric,
yeah, that's, yes.
So I would provide a comment here too regarding the choice of foods and how to kind of combine or integrate Ayurvedic principles into conventional, Western diet. So majority of the patients that I see in my practice, they are unfamiliar with Ayurveda and Ayurvedic diet. Where I am focusing with them is on, like Śankari said, she's focusing on digestion. I'm focusing on inflammation and digestion. So never that I say to any patient that they should become vegetarians. I think my job as a physician is to educate them about the pros and cons of different kinds of foods. And if they understand, if they want to reduce the intake of meat, which I do talk about, because of the inflammatory properties of meat, and it's been shown in many different studies, and the anti-inflammatory diet principle is also the same, to decrease those meats and replace them with other kinds of meats. So I always talk about replacements. I actually have a handout in my practice which I get, that this is how you can replace meat with these things, only if you can. So it's a partnership with someone. And if somebody wants to become vegetarian or they want to become vegan, that is their choice, and I'm going to support them in that too. But it's basically about education about different kinds of food and how to combine them. And you talked about milk, and the lactose intolerance, very, very, prevalent, of course, here as well as in other countries too. I think people are really increasingly becoming lactose tolerant. So we talk about that, and that would be one reason to not have milk. And I think it is trying to find that fine balance between the principles of Ayurvedic medicine and Ayurvedic diet and anti-inflammatory diet, and customizing it to somebody's personal preferences and lifestyle. So just walking that, fine line with them is the key.
Mm-hmm. So it's a tradition that has some very strong principles, but they're very flexible, and it's something that's evolving over time, over centuries. It's not like fixed in stone somewhere.
Well said.
Yeah.
Now, I'm also curious about variety of foods, because in Dr. Wegman, your slide showing that midday meal had this beautiful, like a tally of lots of different types of things. practically speaking, if someone is not going out for lunch to eat that kind of meal, how is somebody supposed to do that in the day-to-day?
Yeah, and so I really like that picture also. Just looking at that picture made me very happy.
Yes, me too.
It's just, I think just, having, as Dr. Elder was saying, just like having a focus of veggies, and what Dr. Prasad was saying, not just a single food, but having, diversity in what we're eating, what we're eating. So looking at our grains, looking at the vegetables, looking at our fruits, spices, looking at the oils that we're having. So all of that is contributing to what is known as a healthy meal, for that individual. So having a variety as much as possible is important. Many vegetables, varying the grains, so not just rice or wheat, but like millet, amaranth, quinoa, barley, having a variety. So that's really helpful. And it doesn't have to be a variety in every single meal, but if we look throughout the week, that there's a great diversity that we're incorporating into our breakfast, lunch, and dinner. So it's not the same thing every day, but we're varying it. And we're also looking at the seasons, what's fresh in that season, what's available in that season, and incorporating what is local, what is seasonal, as well into that diversity.
So let's talk about grains for a second, because so many people are concerned about gluten intolerance. What grains can I have? Can I have any grains? There's some doctors who say people shouldn't be eating grains at all, but it sounds like in Ayurveda there is a fair amount of grain-based food.
Totally, Eric. I'm going to comment on that, and I want to go back to the previous subject for just a moment, and I'll transition it back. Is that the most, because you had, in your previous question, you had asked about, there's the issue of people aren't going out to lunch, and so what do you do? The most important thing to have in your kitchen is a crock pot. If you want to really eat healthily homemade food in the context of a busy lifestyle, because you can make stews and soups and so forth overnight in your crock pot. You prepare it at night, you chop the vegetables, a grain, a whole grain, which we'll talk about, a legume, and you cook it overnight. And in the morning, you pull out your thermos and you bring it to work. It's very practical and very doable. So whole grains play a very important role in the Ayurvedic diet, okay? And there are a lot of whole grains that are good for us and that can promote health. And lots of whole grains. Ideal diet is a vegetarian diet, and whether you're vegetarian or not, whole grains are good for most people. Now, some people have celiac disease, and then they can't have gluten, but they can have quinoa, for example. They can have rice. So there are lots of grains that people can include in their diet, and it goes to avoiding all grains. Every patient is different, but sometimes some people have celiac disease, some people may have some gluten intolerance, but it's important not to get too carried away with that. So we want people to have a healthy diet and to not get frightened off of this important food group.
Great. Okay, I welcome you all out there to send in your questions. I know I've been asking a lot, but I certainly would love to hear from you all what you'd like to learn more about as far as Ayurveda and how it connects with contemporary mainstream practice, or your particular practice settings, or the types of patients that you're seeing. So again, open that questions tab and you can type the questions in, and I'll read them aloud. In the fellowship, while we're waiting, in the fellowship, are you going to be teaching cooking skills or anything like that? I mean, a lot of people need help in that department.
Great question. So the answer is yes. We'll be teaching cooking skills, there'll be recipes. We'll be teaching cooking skills specifically in some of our clinical webinars, in our on-site clinical training. And in our assignments, because this is when people have got to learn how to, before people are going to recommend these things to our patients, we want to sample and learn them ourselves. And it doesn't have to be rocket science.
Great. Tell us a little bit about how the course is structured, actually. I think people would want to know that. Like, how is it laid out? What's the timeline?
Okay. So it's a 2-year program, and at MIU we're on a block system. So there are 22 or 23-ish courses, so that range, and each course is a few weeks, maybe a month, 3 weeks, 2 weeks, 5 weeks, depending upon the content, one after the next, starting August 15th, approximately this year, and then we'll go through till the end of the second semester in June, a mini semester next summer, and then the second year like that. And you'll go one course after the next. The first semester, the first course is a general introduction. The second course reviews whole systems of medicine. The third course reviews mind, body. The fourth course reviews diet and nutrition. By the end of the second semester, we're starting to get into the organ systems. There's a course on gastroenterology, a course on musculoskeletal, and so on. And each course will merge the general integrative medicine curriculum and the Ayurveda curriculum. The general integrative medicine curriculum is provided by the University of Arizona, and the Ayurveda curriculum is being developed and provided by MIU. And so for almost all the courses, there's curriculum from both sides, and it's intermingled in the way that makes the most sense for that topic.
So it really is a hybrid of content from University of Arizona and from Maharishi International University.
100%, yeah.
Great. Very, very good.
There'll also be clinical webinars that's every other week, and the webinars are a great opportunity for that integration to happen with discussion, case studies, experiences, and taking the pulse like that. So the webinars will be live every other week and just provides a great opportunity for clinical discussion.
And the webinars are really where we'll tie, as Dr. Wegman is suggesting, where we'll tie things together. We'll have a case, we'll have a topic, and we'll review. There's the Ayurveda says this, general integrative medicine says that. What do people think? What would you do? And we'll tie it together that way.
Got it. Okay, we've got a question from Rhonda. She's asking, what is the prerequisite for the MS? She says she has a BA in psychology.
Okay, so the MIU has a range of, has a number of training programs in Ayurveda. The fellowship MS in integrative medicine and Ayurveda is for healthcare professionals. So one needs to have an active license, as an MD, a DO, a nurse practitioner, a physician assistant, a naturopath, a doctor of pharmacy, or a dentist. However, we do have another master's program at MIU, which is very similar to this. It's 3 years, it's online, and for that program, the requirement is a bachelor's degree. So for people who are not licensed healthcare professionals, there is another program which is very similar that they can apply to. And it's a big program. There are several hundred students in the MS in Ayurveda and integrative medicine that's already up and running.
Great. What's the best way for Rhonda and for others in her situation to find out about that program?
Go to the website. Go to our website, and if you go to the website that you see there, which links to the fellowship website, if you read down a little bit, it says if you're not a licensed healthcare professional, we've got a great program for you, and that'll move you right there.
Excellent. Okay, friends, we're almost 30 minutes over time, so now's last chance, now or never, to ask questions. I'll ask one more. We talked about diet a lot, and we touched on meditation and the consciousness work. The third leg of the stool, it seems to me, would be exercise. How does that fit into Ayurveda in general, and specifically into this fellowship program? Will you be teaching that?
Yes, so exercise, lifestyle, all of that is also part of the whole program. And as part of that, we will be, teaching, incorporating that value into the program, as well as going a little bit more deeply into yoga. And that'll be something that's practical when the fellows come to the residential weeks. We'll have yoga every day, learn these yoga asanas or yoga postures, and practice together. And this is something that can be incorporated for practitioner self-care, as well as something that can be offered for patients as well.
So this is going to have some direct benefits for the participants, not just their patients, huh?
Absolutely.
And exercise prescriptions, like anything else in Ayurveda, are tailored to the constitutional type and the dosha imbalance.
Excellent. Okay, well, is there anything else that you three would like to add before we close?
Well, I would like to add that this fellowship is one of the first ones in the country, in the world, to have combined the best of the traditional Ayurvedic medicine and the best of conventional integrative medicine. So I'm a board member. I'm a founding board member of American Board of Integrative Medicine, and I've often seen that physicians who are only trained in Ayurveda have not been able to get board certification. So I think this fellowship is going to provide a path for those individuals and others to be able to complete the standard, the foundations of integrative medicine curriculum. One of the best curriculums in the country is from Arizona Center for Integrative Medicine that we are utilizing, and the best of Ayurvedic curriculum from the Masters in Ayurveda program at MIU. So this is, it's not an easy fellowship. I think it's a, it will require work and understanding and participation and engagement. But I think it's going to, the end result is going to be wonderful. It's going to support the cause of making or taking Ayurveda to mainstream, because you would be a practitioner who would have knowledge of a lot of good stuff. With emphasis on Ayurvedic lifestyle and Ayurveda, but having a significant and solid foundation of integrative medicine as well.
Excellent, excellent, excellent. Well, thank you all. This has been a pleasure. Thank you to Maharishi International University for sponsoring this and for bringing together this wonderful faculty and for making this fellowship available. I encourage you all to learn more about it. Go to www.miu.edu/fellowship-ms, and that's where you can find out more information and how to register for that. Watch for an article from Dr. Elder in the upcoming summer edition of Holistic Primary Care. That should reach you in early to mid-June. We're working on that one right now, and we'll be featuring an article summarizing some of what you've heard tonight and some other details. And with that, again, thank you all, Dr. Wegman, Dr. Elder, and Dr. Prasad. Sure to appreciate your time and the knowledge that you're bringing to this. And thank you all for participating, and I hope the presentation has been intriguing and engaging for you. And watch for more great content coming up from Holistic Primary Care in the next few weeks. So with that, sign off.
Thank you, Eric. Thanks, everyone.
Thank you, Śankari. Thank you, Charles.
Thank you, Dr. Prasad. Thank you, Dr. Wegman.
Okay. Be well, everybody. Good night. Take care.
Good night.